Hello and welcome back to Charlotte, North Carolina. You're going to see a very special demo. I'm going to get my dry eye, which is almost cured, my third treatment treated today. You're going to see the Forma eye and the Lamecca eye. We're going to be treating right up to the ciliary lash line with that Forma eye for meibomian gland dysfunction. We're going to liquefy the hyperviscous sebum that was trapped and couldn't get out, which is why my tear film lacked lipid and it felt irritated and dry all the time. You're also going to see Lamecca eye, which is adaptive Lamecca for the periocular space, so we can treat it right up to the ciliary lash line and over the upper lid. I will trust that Jim is not going to treat my cornea. Therefore, I will be able to talk to you while getting it done. Normally, use a plastic shield, just for medical legal reasons. You're going to see both of those treatments on the same session. I will not do the Morpheus, because I don't want to look too young. So let's have a look. Okay, I'm going to get positioned here, and Jim, walk us through what you're doing and how you're doing it.
So essentially getting the patient in a comfortable position. We're going to be putting some pressure, light pressure around that upper lid, lower lid area, and having the patient comfortable. They can sit there for a while in a position where you can be comfortable as well.
Zoom in a bit here. Let's just get, this is a, yeah, right in, come on in. Perfect.
Perfect. So essentially always just start with a little bit of 70% alcohol, just a little alcohol wipe to remove any residue that's on the skin surface itself. Make sure it's good and clean through there.
You're taking my makeup off.
Have you been compliant with your skincare?
I have Irish Spring every morning.
There you go. So once we get the area cleaned off, we'll just treat one eye at a time. So I'm going to apply a little bit of ultrasound gel. It doesn't take much at all, to a tongue depressor blade, and then I'm going to put a little bit just on the upper, a little bit here on the lower. And that's a sufficient amount right there. I can add a little bit if needed. And then just always instruct the patient to just kind of keep that eye closed, make sure an ultrasound gel doesn't get in there itself.
So maybe let's go over to the machine, Jim, and let's look at the buttonology and walk us through the settings, because the Forma eye, way less aggressive than the Forma that you saw us treating the cheek with. Walk us through parameters.
Correct. So here on the screen, you can see we've got the 580 IPL handpiece that's hooked up. It says IPL. Then we've got our Forma eye option that's there. It's hooked up as well. Same design as the Optimus that Dr. Mulholland mentioned earlier. The cooling's on the front and the RF is on the back of the system. We're always going to start with Forma eye when we're doing the combination protocol with that. So I'm going to select my Forma eye. It's going to go into the treatment screen. Like I mentioned earlier, all of our devices have a quick reference guide that you're going to be able to start with. That starting protocol in the quick reference guide is perfect. It's spot on. So it says an RF energy between 4 to 5. I let offices know that this is a technique that you're going to kind of have to get used to. So there's nothing wrong with starting at 3. That's going to allow you to move just a little bit slower while you're working on the pressure on the eye and the articulation with your hand and making sure you maintain good skin contact. Then for the cutoff temperature, same as we mentioned earlier, we like to be at least around 40 to 43 degrees Celsius. I typically like to start at 42. Check my patient sensitivity. If the patient's fine with it, then I'll bump up to 43. Dr. Mulholland, this is his third treatment, so I know 43 is comfortable for him based on previous treatments, so I'm just going to start there at 43. This last selection down here is just your pulse mode itself. Single means you'll have to reset your foot on the pedal. We always put it in the repeat mode. That way you can continue the pedal, have it depressed, and just continue the treatment the whole time. So from here, we lowered the bed a little bit to make it so I can treat over Dr. Mulholland. That way I can maintain good skin contact. And then you can see here we've got ultrasound gel. I've got my probes and my foot pedal down there. I'm always going to make skin contact first, just like that. Move my hand just a little bit. I'm going to treat here on the side so y'all can see a little better.